Hello and welcome back to the Matrix Green Pill podcast. I'm your host, Hilmarie, and today I am thrilled to be speaking with someone who's making a remarkable difference in the lives of our furry friends, not just through medicine, but through compassion, understanding, and innovation. Dr. Katrin Jahn is the founder of the German Veterinary Clinic in Abu Dhabi, a double board-certified specialist in veterinary behavioral medicine, one of only around 10 in the world, and a passionate advocate for the mental and emotional well-being of animals. From pioneering fear-free and zero-pain practices in the Middle East to launching Trinity Veterinary Behavior, an online learning hub for pet owners and professionals, Katrin is leading the way in holistic veterinary care. Absolutely amazing. Katrin, welcome and thank you so much for joining me today.
Hi there. Thank you so much for inviting me. I'm delighted to be here.
So let's begin by getting to know you a little better. Can you tell us about your background and what inspired your journey into veterinary medicine and behavioral care?
So I think I knew from a very early age that I wanted to be a vet. And I think many of us that are vets do. So I think I already knew when I was kind of in my early teenage years. So I had grown up with animals. I was a keen horse rider when I was a young girl. Veterinary medicine was always the thing that I wanted to pursue. So that's what I did. So I've been a vet for just over 25 years now. And in 2008, I actually opened my own veterinary clinic here in Abu Dhabi in the UAE after having worked in many different places prior to that. But 2008 was the year that I founded the German Veterinary Clinic. And one of the things I realized after I opened my own practice is that as a profession, we're amazing at taking care of the physical health needs of our pets, but we're not so great at recognizing and treating mental and emotional ill health disorders. So fears, phobias, anxiety, emotional states that can lead to aggressive behaviors, unwanted behaviors, abnormal repetitive behaviors, and the list goes on. There are so many mental and emotional ill health diseases that pets experience, and that's just not something that we're trained really to diagnose and to treat. It's getting better now, but certainly when I was at university, it wasn't something that was a big focus. And I wanted to change that. So in 2019, I actually started a residency, so a specialization program into veterinary behavior medicine. I passed my exams end of last year and the second one early this year. So yeah, that's where the double board certified specialism comes from.
Amazing. You've certainly focused all in on pet health or veterinary health. I mean, as you said, since a young girl, this was your dream. And you have certainly followed your passion throughout your career. So you mentioned having opened the German Veterinary Clinic in Abu Dhabi back in 2008. What led you to open this clinic and how has it evolved since then? Or do you think you've already answered that?
No, I think that's a great question. So it's actually funny what led me to open the clinic. So I was never wanting to open my own clinic, or that was never something that was kind of part of the plan. But when I came to the UAE, what I really loved about living here and being here is that sense of opportunity and that sense of anything's possible if you put your mind to it. And then I think a few people sort of encouraged me a little bit on that journey and said, why don't you open your own clinic? And I think the UAE gives you those opportunities and possibilities, or it gives you a platform to be able to do that. And that's what really led me to opening the clinic. And the evolution has really been incredible. So I started off with just myself and two members of my team. So there was one qualified veterinary nurse and another sort of junior veterinary nurse who opened the clinic with me. So there were just the three of us. And now, 18 years later, we're a team of over 25. It's been a huge learning curve. There's been a massive sort of growth in the clinic, but also in the way that we practice and the services that we offer. So in 2014, we became the first certified gold standard cat-friendly clinic in the Middle East. So that was kind of our first step on that journey to sort of mental and emotional health, I guess, in pets. So being a cat-friendly clinic means we really take care of the behavioral needs of cats whilst they're in the clinic. So providing them with separate waiting areas, separate hospital areas, and so much more. And then we went on to becoming a fear-free certified practice. That was actually just last year. So we're one of the first outside of the US and Canada to have gotten that sort of certification. That's quite a tough process. And yeah, everything's just evolved over time. And we've just gotten better and better and better at making sure that our patients have a really great experience whilst they're in the clinic and that they don't feel scared or stressed.
Well, that's absolutely incredible. What growth. And as you said, the UAE certainly offers the platform for possibilities and opportunities for those who are willing to take it. And you've done remarkably well. You mentioned about the fear-free and zero-pain practices that you've brought to the Middle East. For those who don't know what that is, how do these approaches change the experience for pets and their owners?
Zero pain is definitely a movement to manage both acute and chronic pain in our pets. So we know that especially chronic pain is something that traditionally has been kind of almost overlooked. And it's also not that easy to diagnose. And I think a lot of our pets live with chronic pain or chronic discomfort. Oftentimes, as they get older, we think they're just getting older, but maybe they're actually suffering from osteoarthritis and they're experiencing pain. So zero pain is really a movement that's geared towards better recognition and better treatment and management of painful patients. And that also refers to patients that are in the clinic that are having surgical procedures. So making sure we use a really multimodal approach, that we use local anesthetics, for example, just as would be used in human medicine. So that's zero pain. Fear-free is a bit of a bigger philosophy, I guess. So fear-free was started probably around 10 years ago in the US and is really a movement towards reducing fear, anxiety, and stress that pets might experience when they come to the veterinary clinic. So there's quite a lot of research out there, and one of the sort of more famous studies shows us that about 8 out of 10 dogs are fearful or show signs of fear when they come to the veterinary clinic. So they'll show different sort of body language signs or facial expression signs or even behavioral signs that they're not comfortable and that they're experiencing fear. And it might be that they've learned from a previous veterinary visit where they maybe received an injection and that was painful or uncomfortable. And that learning then carries on into the next visit. And that's what Fear-Free tries to address. So we try and create an environment, and that already starts potentially in the home or as the pet arrives at the clinic. So we try and create an experience where that pet has minimal fear, anxiety, and stress. We really look at their body language. If we feel that they're escalating, that they're getting too scared, we have lots of different approaches that we can take. We can either offer anxiety relieving medications, or maybe we give the patient a break, or maybe we do things in a different way. So there are a lot of things that we can do to sort of enhance that experience. And the end goal is always, obviously, to address their mental state in that moment, but also to prevent more fear learning so that the next time they come to the veterinary clinic, we haven't got that compounding of them being scared and being fearful, but actually that they remember coming to the veterinary clinic as, you know, either something nice or something that's not fear-evoking or scary.
Yeah, that makes absolute sense, because a bad experience, it just compounds every time they come, and that's repeated over and over again. Their fear levels will certainly increase every time they have to come to the clinic. And I'm so sure the pet owners who love their pets will absolutely love your approach to trying to make it as comfortable for their pets when they bring them to the clinic. I love that idea. I just want to come back to something you said we spoke about earlier, and I think I also mentioned it in the introduction, that you are one of only 10 double board certified specialists in veterinary behavior medicine worldwide. You mentioned that you got that certification, which was quite hard, in 2019. What does that achievement mean to you?
There's so much hard work that went into that, not just the exams themselves. So the exams, so I did, obviously the double board certified comes from the fact that I did a residency in 2 different colleges, the American College of Veterinary Behaviorists and the European College of Animal Welfare and Behavior Medicine. And each of those colleges have their own set of exams. So the exams themselves are really tough events. So for the European College, it's a 3-day event. For the American College, it's a 2-day event. So they're 3 and 2-day exams. But there are 5 years that lead up to those exams. And in those 5 years, you have to fulfill a certain number of training criteria. So, for example, I had to see 400 clinical behavior cases and document them all. I had to publish some original research. I had to publish a case report. So there's so much that goes into it. And so when you finally kind of come out the other side, having passed those exams, it means a whole lot. Number one, as a personal achievement, but number two, also, I think it changes the impact that you can have globally, because you're now recognized truly as a specialist in that field, and it opens doors for you to be able to educate more around this topic, contribute to more research, contribute to writing educational materials, book chapters, and so on and so forth. So I think from a personal point of view, just that achievement has meant a lot. But I think looking at it from a bigger picture point of view and what's actually my purpose and why am I here and why am I doing this, it just really expands or has expanded my global reach and how many more animals I'm able to serve through that.
Yes, excellent. Well, congratulations. That is a fantastic accomplishment. And then, as you say, you're able to not only help animals, but also help other people to progress in taking care of animals. You created a platform called Trinity Veterinary Behavior, which emphasizes a holistic approach, mental, emotional, and physical care. Can you tell us a little bit more about the platform, what it is, and why did you create it?
Yeah, absolutely. So Trinity Veterinary Behavior is a global online platform. So there is no bricks and mortar building that goes with it. So very different from my veterinary clinic here in Abu Dhabi. It's an online platform that is both an educational hub for other professionals and for parents or pet caregivers. So there's something in there for pet owners, but also for other vets, for vet nurses, for non-veterinary behaviorists, for trainers. So any other kind of pet care professional. I have courses in there, webinars, lots of other different things. I also have a podcast myself that kind of goes along with that. I wanted to create Trinity really to build a platform exactly for that, for being an educational hub. Now, you can also book online consultations through Trinity. So I do a lot of vet-to-vet consults, for example. Let's say there's a vet maybe in the UK or somewhere else in the world that's either struggling with a case or that has a very tricky patient coming into the veterinary clinic and they want to get some ideas for how they can manage. That's where those vet-to-vet consultations come in. And they're really popular. And I absolutely love doing those because it's just such a nice way of giving back to the veterinary community as well. But even if you're a pet owner, you can book an online consultation via the platform. So there are lots of different ways to connect with me. And yeah, the whole idea behind it really was to create a global reach, as I've mentioned a couple of times, and to really start spreading the word and being able to impact more pet lives through that platform.
Yes, and I love how you said this is your way of fulfilling your vision for yourself, for your own purpose, and impacting so many more people, whether that be pet owners or other professionals that's looking for help. You've also launched online courses like Learn to Speak Dog and Learn to Speak Cat. I love that. What can people expect to gain from these programs?
Yeah, so Learn to Speak Dog and Learn to Speak Cat are my kind of passion projects. So they contain the information that I feel every pet owner or pet professional needs to know if they are either living with or working with animals. So they're kind of your foundational pieces around behavioral health and understanding pet behavior better. So it's a modular online course. The Learn to Speak Dog course has 7 modules. The Learn to Speak Cat course has 6 modules, but they each contain around 5 hours worth of content, but broken down into tiny lessons. So each lesson is like a single train of thought and can be anywhere between 5 and 25 minutes in length. So really easy to digest. But the way I describe these courses is a little bit like being a fly on the wall in my consultation rooms. So I will invariably, during a one-to-one consultation with a veterinary behavior patient, I will invariably use a lot of this information to educate the pet owners, the caregivers, and to help them understand a little bit better why their pet might be behaving in a certain way. So we talk about emotions, we talk about communication, so that's body language, facial expressions, behaviors. We talk about socialization, which is really important for dogs and for cats. So they're quite different in their social interactions. So dogs are much more kind of, I guess, sociable in terms of being able to live in social groups. Cats, not always so much. So that's something that I talk about is the differences between dogs and cats and why sometimes that can pose a problem, especially for cats. Then I talk about learning and training. What are the different sort of learning theories and what are the best ways to actually help animals to learn and to train them? And then I talk about enrichment or environmental management to kind of provide the very best environment for that pet's behavioral health. And then I also talk a little bit about some products that I absolutely love, whether that's a natural supplement or maybe a pheromone product or potentially some diets that are great for behavioral health. So it just gives a 360, quite basic foundational view of what pets need to be happy and comfortable and live really happy lives when they're living with us.
I love that. I also like the idea that there's a different program for dogs and for cats, especially when you're a dog and cat owner, that you don't expect to treat them the same, that they do have different needs and they do communicate differently. Is there a big difference in the different kinds of breeds, let's say of dogs? Because there's such, and cats as well. Would you treat different breeds of dogs differently?
I think it's really interesting to always look at what were they bred to do. So, for example, our Labradors, they're bred as gun dogs, right? So they're bred to use their noses and retrieve things. Whereas maybe our Sighthounds are bred to chase things and run fast, versus perhaps maybe our more sort of designer breeds who are bred more as to be companions for us. So absolutely, when you think about different breeds, we want to make sure that we meet that breed's behavioral needs. So if you have a collie, for example, that's into herding or that's very active and really intelligent, we might want to be doing different things with those guys than if we are maybe living with a pug who really is a companion and really thrives on that one-to-one personal attention. So yeah, I think you're absolutely right there in asking that question. There are definitely breed differences. We always look at what that breed really needs and what they're bred to do, and then we can provide that in a really appropriate way within our homes.
I also think this is probably a really good course for somebody might never have had a pet before and they're a little bit nervous about getting a pet for the first time, to maybe do this kind of online course where they learn a little bit about how dogs and cats communicate, and then they sort of set them up a little bit better for bringing their first pet into their home.
Yeah, 100%. I think it's such a great way of looking at it, because it's all that foundational information that you need to know, whether you're a seasoned pet owner or whether you're a first-time pet owner. But I think you're right, especially for first-time pet owners who absolutely want to do things right. And we know this. People always want to do things right. Sometimes they're a little bit misguided by some of the information that they receive, but everybody wants to do the best they can. So having a course like this that's really science and evidence-based and that comes very much with a medical background attached to it, I think would be a really great thing for a first-time pet owner.
Sort of along the same lines, what are some common misconceptions that people have about pet behavior, especially when it comes to issues like aggression or anxiety?
I think one of the biggest things that we've been fighting for many, many years is this idea that dogs live in some kind of a linear pack structure, right? So that people often refer to them as the alpha dog, or we just need to show the dogs who's boss, or we need to be the alpha. And in fact, it's been disproven time and time again that that is actually true. So the original research that was done around that was done in captive wolves many years ago now, back in the 1960s and 70s. And the researchers that did that initial sort of work actually went back and redid their work, and they looked at wolves that lived in a natural setting. And what they actually found is that wolves don't have linear dominance pack structures, but actually that they live much more in sort of family style groups. And that's a lot what we see in our domestic dogs as well. And that's why they make such great pets, is because they're able to fit into our lives in that sort of family group setting. And unfortunately, because there's so much talk still about dominance and alpha and pack and all that sort of thing, there was a movement of training, again, that initiated in the 1970s and 1980s, that was this sort of rank reduction training where dogs would be pinned to the ground or alpha rolled, or silly things would be said like, you always need to make sure that you eat before your dog, or you go through the doorway before your dog, which is all not true and probably actually quite destructive to a lot of dogs. And unfortunately, these training styles have kind of carried through, and we still hear that being spoken about today. But in fact, if you employ some of these practices, that can actually cause anxiety, because you are the dog's main caregiver. You're the person that they're most bonded to. And on the one hand, the dog wants to have a really close social relationship with you, and that's what we want as well. But on the other hand, you're using some of these strange punishment-based methods that the dogs just simply don't understand. And then they start to become fearful or conflicted in their relationship with you. And that's probably something that I see a lot in my behavior cases, is where the dogs then start to react defensively, or because they're not quite sure how to manage some of these social situations because it just doesn't make sense to them. And that's maybe when they start to growl, or when they start to show behaviors that are defensive, aggressive behaviors. So I think that whole dominance theory piece is probably one of the biggest myths and the biggest misconceptions that's out there. And yeah, we're trying hard to eradicate that from our vocabulary.
The dog owner needs to be sort of, as you say, the alpha. That's really interesting science. If we are not to raise our pets with like a firm hand or that dominance, What is the better way to do it?
So I think the best way to do it is to actually build a relationship with our dogs and to give them coping skills and coping strategies so that they can actually fit into our homes, our lives, whatever it is that we ask of them. Because some things that we ask them to do, like go to the coffee shop with us, or maybe to go for walks in urban environments where there are lots of noises, maybe construction, maybe kids, maybe other things. Some of those things aren't necessarily that natural, and some dogs can really struggle with some of those things. So teaching them early on coping skills, coping strategy, being able to read their body language and being able to read how they're feeling in certain situations so that we can either change that or teach them not to be afraid in those situations. That would be one thing. And then from a learning point of view, I think using positive reinforcement so that we're actually rewarding the behaviors that we do want and kind of ignoring or redirecting the behaviors that we don't want. And the sooner we can do that consistently when the dog or the cat is a young animal, the better it's going to be. And they're going to understand really, really quickly what is expected of them, what behaviors are appropriate, and what are the things that we perhaps don't want. But we don't do that by punishing them. We just do that by ignoring it and giving them a better option, showing them a better way of behaving in that moment, and then rewarding and reinforcing that. So it takes a little bit of a shift in mindset, a slightly different approach, but all the evidence and all the science proves that positive reinforcement learning is so much quicker, so much stronger, and doesn't have any of those unwanted side effects like fear, anxiety, aggression, conflict, not being sure of actually what's expected of them. And of course, consistency is a big thing, right? Always making sure that we toe the line, whether that's if we're living in a family or the family members having a similar approach. But a lot of it is about actually understanding behavioral needs, understanding emotional state, and understanding the body language that comes with that.
That makes absolute sense. So rather use the carrot than the stick because it's got far better outcomes. This also reinforces the idea that pet owners need to educate themselves on what works best for pets. And I think, again, your online tools that you've made available to help pet owners along the way is so valuable to really understand the benefit and also, as you mentioned, the negative consequences of employing the wrong kinds of training, if we want to call it that. I love that you've lived up to your passion and that your passion for animals is out there, is helping other people to become better pet owners themselves. What's next for you? Do you have any projects that you are working on?
Well, I've actually just launched another course, but that's more aimed at veterinary professionals. So I've launched a course on psychopharmaceutical medications, and I've got loads more ideas for Trinity going forward, lots of different kind of educational tools and platforms and things like that. Also this year, I'm doing a lot of speaking. I'm actually traveling to the UK tomorrow to speak at a big conference there. And I have a couple of other conferences this year, speaking at the World Small Animal Veterinary Association conference in Rio in September. So there's lots going on at the moment. And it's actually interesting being such a sort of, I guess, a new specialist. So having just passed my exams only recently, finding my feet and finding my place within that role is also really interesting, and understanding what I really love doing, what I have a passion for, and what are some of the things that I don't love doing so much, and just kind of finding my way. But there's so much still to come. Another thing that we're planning to do at the German Veterinary Clinic, probably either end of this year or next year, is to open a dedicated pain clinic. Because as I mentioned earlier, pain, especially chronic pain, is something that, again, as a profession, we're not great at recognizing and treating and managing well. So that's another sort of big plan for that physical clinic here in the UAE. But yeah, watch this space. Lots to come.
My goodness, you are certainly busy and flying off tomorrow. So thank you very much for making the time today. I really appreciate that. You've done so much good and you continue to do so much. Congratulations on that. Now we've come to the segment of our show where I will ask you some rapid fire questions, our version of a game show. Are you ready?
Oh, okay. Yep, I'm ready.
If you had to choose, dogs or cats?
Cats.
The most unusual animal behavior case that you've worked on?
I think maybe parrots plucking their feathers out.
I think you might have answered this, but I'll ask it anyway. One animal-related myth you wish people would stop believing?
Dominance theory.
What is your go-to activity when you're not working with animals?
I love horse riding. I love going to the gym. I love doing yoga, walking.
What is one thing you do every day, no matter how busy you get?
Have my morning coffee with my husband.
Lovely. Well, thank you for playing along. That was easy enough. Now I would like to ask you our signature green pill question. Could you share an inspiring or life-changing experience that you have gone through, your green pill moment?
Yeah, so this takes us back to quite a few years ago when I was just 4 years old. When I was 4, I was admitted to hospital for a very routine procedure. I had a little umbilical hernia that I needed to get repaired. So this was back in the late 1970s. And I can, to this day, many, many years on, still remember that as being quite a scary and traumatic event for me. And it kind of keeps popping up in my thoughts and in my memory. And I sometimes find myself thinking about those days that I spent in hospital. And I asked myself, why do I continuously think about that? And then it brought me back to thinking about the things that I think impacted that most. Number one, that was being separated from my parents. So again, back in the late 1970s, parents weren't allowed to stay in hospitals. They only were allowed to come during visiting hours. And the rest of the time I was alone. Being in an unfamiliar environment, not being at home, and especially that not having my parents with me. So that unfamiliar environment. And then I can also remember handling is the wrong way of saying it, but I guess being cared for by nurses who were quite strict and quite stern. I remember in particular, there was one matron who was really quite an imposing presence at the time to a 4-year-old girl. And so when I think about that experience that I had when I was 4, I very much relate that to how my veterinary patients must feel when they come to the clinic. So exactly the same thing. Let's say they're staying for a routine procedure, maybe a neutering or maybe a dental procedure. They're being separated from their caregivers. They're in an environment that's completely unfamiliar to them, and they're perhaps being handled by people that they don't know and they maybe don't like that handling. That green pill moment, I think, is really something that I've translated from when I was 4 to everything that's sort of the thread that's carried through my career and why I've gone down this path of cat-friendly, fear-free behavior medicine and trying to improve that experience. And what we're now actually doing is we're not experimenting, but we're starting to implement the concept of open concept into my clinic, which is that pet owners can stay with their pets, even if they're admitted to hospital. We've got a working space. They can bring their laptops. They can work from the clinic. We've got coffee machine there. They can actually stay with their pets. Maybe their pet needs to be on an IV drip for a few hours, or maybe their pet's having a procedure. And I just love the idea of the caregivers being the last people that the pets see before they drift off into anesthesia. And then their owner's faces being the first thing that they see when they wake up from anesthesia again. And honestly, delightful thing for me to see is when a dog wakes up from an anesthetic, they see their owners and their tail immediately starts wagging. So that whole idea of open concept and actually bringing the pet owners into their pet's healthcare journey and allowing them to stay with them, not whisking the pet away somewhere where the owners don't know what's happening to them. That for me is something that's becoming more and more important. And that's the direction that we're heading in. And I think a lot of that has to do with that experience that I had as a 4-year-old little girl, where I felt really quite lost and quite frightened by the circumstances that I found myself in.
Thank you so much for sharing that very personal experience. And I can imagine, as you say, for a 4-year-old, that must have been a really scary and traumatic experience, and how that has now shaped your compassion in the way that you deal with your animal patients as well as the owners, because it's traumatic for pet owners for their loved pets to be taken away, not to be there when they're going through big surgeries or anything that's difficult for them. So I love how that's translated to how you're living your whole life. It's absolutely fantastic. Again, I know how busy you are, so thank you so much for joining us today. Your work is inspiring, not just because of your dedication to animals, but also because of your passion for creating real lasting change in the veterinary world.
Thank you so much. It's been my absolute pleasure to chat to you. Thank you.
Before we wrap up, where can our listeners connect with you and learn more about the projects and the courses that you offer?
So they can come and have a listen to my podcast, which is the Pet Behavior Chat. It can be found on most podcast platforms, or Instagram at Trinity Vet Behavior, or my website, which is trinityvetbehavior.com. Of course, they can find me if they're in the UAE at the German Veterinary Clinic in Abu Dhabi. And I also have a really great Facebook group called the Pet Behavior Community, where I share lots of resources. I do live Q&As and lots of other things. So yeah, lots of places to find me.
Fantastic. Thank you so much. And to our listeners, thank you for tuning in to the Matrix Green Pill podcast. If you enjoyed today's episode, be sure to subscribe leave us a 5-star review. Until next time, take care of your pets, take care of yourself, and never stop learning.
If you enjoy our conversations, please like and subscribe. See you next Wednesday.